So spinal cord extends from the base of the brain down the back of the canal referred to as spinal canal. The cord consists of nerves, that encase in 31 vertebrae for protection, and the spinal cord branches into 31 pairs of spinal nerves that extend from the cord to the limbs and the lower parts of the body. The root word for spinal cord is myelin. Like the brain, it is protected by 3 layers of meninges and the CSF. So now the peripheral nervous system consists of cranial nerves that extend from the brain and the spinal cord, which extend from the spinal cord. We have 12 pairs of cranial nerves. They are named for the area they affect or the function they are responsible for, such as areas of the body, such as the eyes, the face. We have the throat, the mouth, the tongue, and the thorax. And there are 31 pairs of spinal nerves, which are generally named for the artery they accompany or the body part they affect. Example, the femoral nerve affects the muscles along the femur. The autonomic nervous system is divided into parasympathetic and sympathetic. Each division acts as a balancer of the activities, of the other. This allows for homeostasis. So sympathetic is concerned for preparing that body for emergency stressful situations. Like, for example, let's say a quick reaction to like a lion just came in or something in front of your door, it'll prepare you for it.